Doctors in this country are warning of a new public health crisis after pandemic lockdown measures caused delays in cancer diagnosis and treatment. In 2020, more than half of the people with cancer in Canada saw appointments, tests, or treatments postponed or even canceled. Dr. Anthony Ryman is a medical oncologist and the Canadian Cancer Society Research Chair at the University of New Brunswick. He's our guest this morning. Welcome.
Good morning, Anne-Marie. Thanks for having me.
What is the situation like for your patients after 2 years of delays?
Well, Anne-Marie, early on in the pandemic, there were certainly great restrictions on access to healthcare broadly, and this affected the ability of our patients to access the system mainly through their primary care providers, their family doctors, their nurse practitioners. In cancer care, we, across the country, did our best to keep cancer care going. And so patients who were already in the system, we did our best to keep looking after them and just to take precautions to minimize the risk that they would contract COVID-19. But patients who had not yet been diagnosed had some struggles getting access to care. Now, a couple of years later, I would say that the system is fairly open. Patients can access the system, but there are some staff shortages, I think, that have emerged during the pandemic that have persisted. And I think some people are still a little bit reluctant to access the healthcare system. There's still some fear of COVID-19 out there.
What are we seeing in terms of rate of cancer diagnosis now?
Well, there's data that would suggest that during the pandemic, there were delays in diagnosis and reduced numbers of diagnoses. And I think we'll only see the full impact of that in years to come. Some of this has to do with limited access to cancer screening for early diagnosis of cancers for which we have screening programs. But some of the other cancers, like blood cancers, for which we don't have screening programs, we're relying on patients to present with their symptoms, and so they need to be able to access the healthcare system to get their symptoms evaluated.
Yeah, let's dig into that a little bit. September, the month we're in, is Blood Cancer Awareness Month. Roughly 155,000 people in this country live with a form of blood cancer. So what do people need to know about this particular group of cancers?
Well, you're right, Anne-Marie. It is a group of cancers, leukemias, lymphomas, multiple myeloma, and other blood cancers. And individually, no one of these is as common as, say, breast cancer or prostate cancer. But as a group, more than 20,000 people will be diagnosed with a blood cancer this year. And so they're actually fairly common as a group. And as I said, we don't have screening programs for these, and mostly rely on people presenting with their symptoms. So it's helpful, particularly for healthcare providers, to think of blood cancers when patients present with symptoms. I think it's helpful for Canadians to be aware that advances in care for blood cancer have been achieved through research over the last decades. And yet there's still work to be done. And so it's important to support research on blood cancers.
You know, we know that there's going to be more pandemics in the future. Is there a new COVID, with this new COVID variant spreading, how can we better prepare our cancer care system for disruptive events like this?
Well, I think we've learned a lot from the recent pandemic, the SARS pandemic, and others. And you know, these events are have historically been infrequent, but I guess we never know when the next one's going to happen. Hopefully, the lessons we've learned will improve our preparedness for the next pandemic. When it comes to patients with cancer in general, blood cancers in particular, blood cancer patients are more susceptible to COVID, both contracting COVID and developing a more prolonged or severe COVID illness, particularly if they've been undergoing cancer treatments, because their immune systems are suppressed. And this is perhaps even more true for patients with blood cancer than other types of cancer. So we're continuing now to take precautions in our clinics to prevent those patients from contracting COVID. And I think it's important for people to remember that there's still good testing available, and that if you have a blood cancer and you get COVID, you should be tested. And then if you have COVID, there are potentially treatment options available that can reduce the severity of your illness. An
important reminder, especially for this time of year. Dr. Ryman, thanks for coming on today.
Thanks for having me, Anne-Marie. It was a pleasure.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.